Estás viendo Canal América, televisión dominicana para el mundo.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got. But the world takes you down. You just keep moving on. Let your fears.
Welcome to A Time for Truth show. I'm your host, Dr. Bernard Fialkoff, and it's a pleasure to have you back with us again. And one topic that I'd like to cover is, many of you have been asking, how do I get the previous shows? So very simple. You go on YouTube and you look for A Time for Truth show and you click on subscribe and you will be able to get all the previous shows and segments which have been for the last few years now. So tonight we have a very special presentation because it has to do with our children and their well-being, and also has to do with the profession of medicine and, the responsibility, the Hippocratic oath that we take on as doctors to help patients. And tonight, Fermin, if you can put her up on the screen, the pictures, I will introduce our guests, Dr. Ana Olivero, a fellow of the American Academy of Pediatrics, board-certified pediatrician, originally from Barahona of the Dominican Republic, and graduated with honors at Salome Urena Girls Institute, subsequently the medical school at the University Autónoma de Santo Domingo in 1985, while at the same time working as a pathology lab assistant professor. She continued her medical training at Robert Reed Cabral Children's Hospital in Santo Domingo, while working as a research member of Mother-Child Health Center under the directorship of Dr. Hugo Mendoza, the father of Dominican pediatrics. And there you see her in her office, Hola Pediatrics. From 1988 to 1991, Dr. Olivero completed her internship and pediatric residency at Escola Paulista School of Medicine in Sao Paulo, Brazil. The doctor moved to New York and in 98 completed her residency at Stony Brook University Hospital, where I actually received my own dental specialty training. And there she was certified by the American Board of Pediatrics in 1999. From 98 to 2002, Dr. Olivero worked as an attending physician of the Pediatrics Emergency Department at North Central Bronx Hospital. And in 2002, she joined the Division of Emergency Pediatric Medicine at Columbia Presbyterian Medical Center and served as liaison for critically ill children and tertiary care hospitals in New York City for families in need of humanitarian, surgical, and medical care. Dr. Olivero strongly advocated for these patients, along with Dr. Juan Tapia Mendoza, founder and director of Pediatrics 2000. When Tropical Storm Noel hit the Dominican Republic in 2007, she served in disaster response from New York Presbyterian Hospital, and for more than 15 years, as Father David Kearney of St. Elizabeth's Church has successfully organized humanitarian trips, providing medical, dental, and pharmaceutical services to many, many patients in rural countries, communities, and in the communities of the Dominican Republic. Dr. Olivero has served as chief physician on these trips. She's also participated in another yearly humanitarian trip to her Dominican Republic home, to deliver medical and surgical services to rural communities. She directs her practice, Ola Pediatrics, in the Bronx, aspiring to deliver the highest quality care in a child-friendly environment. And with over 25 years of experience in hospital and community-based pediatrics, she believes in a team approach to children's health and well-being. And Fermin, if you will, let's welcome to A Time for Truth show, Dr. Ana Olivero. Welcome, Dr. Ana Olivero, to A Time for Truth show. How are you?
I'm doing wonderful.
That's great.
Thank you.
That's so good. You know, we have so much to cover. So I wanted to ask you, how did you decide to become a physician?
It was a direct line decision. I knew since I was a child that I wanted to be a doctor. I had a curiosity very strong for biology. I wanted to know what was inside animals. So if I saw a small animal that was dead, my impulse was to look inside and see how was it like inside.
Amazing. And now, so then you became a physician, and then what led you then into pediatrics and children?
I had the opportunity to train with Dr. Hugo Mendoza. He is a Dominican scholar, the founder of pediatrics in Dominican Republic. So working with him, I was greatly inspired by his expertise as a strong pediatrician and his compassion and love for the profession.
I can imagine someone of that stature, it must have been so rewarding, right?
Truly inspirational and a true privilege for a young physician looking for guidance. And I certainly found it at the Robert Reed Cabral Hospital under the leadership of Dr. Mendoza and all the staff.
Well, that's a beautiful thing. I was going to ask you, because I know a lot of the parents watching our show today are going to be very interested, is what are the common health problems that you're seeing in your practice, you know, in kids and in young people?
Here, where I practice in Bronx, New York, we have the common denominators. They call these the social determinants of health. And what that really means is that children are greatly affected by the environment, by the geographic areas where they live, by the opportunities that you could find or you could not find as a child. And I'm going to name a few of them. We have a high incidence of asthma and respiratory conditions, and we know they are all linked to living situations and environmental hygiene. We have a high incidence of obesity, weight management programs, and it's all related to food access, to food understanding, and a new relationship with nutrition, which is lacking in our current status and our current cities and the way we are educating our kids. We also have the great impact on the emotional, the mental well-being of children and adolescents for the pandemic, but before the pandemic, for the determinants of health, the social determinants of health that I just mentioned.
Very interesting. And so, what do you feel parents should do? Is it a matter of modifying the environment, or do you feel that the nutrition also is involved? Or how can they take a proactive role? That they can take at home, including like what you do, obviously, as a pediatrician.
Yes, certainly. I have the privilege to work with families in Bronx, New York, which is an area where there are many families with financial challenges. I deal with many parents. We all have to bring a living for the home. We all need to provide for our kids. And I am lucky that the parents that I work with are very loving, as many parents are, and most parents are, and very engaged with the kids. I believe that the best we could do for our kids is to set an example of the things that we want plant in the garden of their lives. It's important to remember that the kids learn by copying the behaviors that we show. It's the greatest impact that we could put in their lives is to set examples by the way we are and the way we treat them and the way we show them the path to growth, development, and health. So for example, if you want kids that are going to be successful in managing a healthy way, not having all these diabetes, hypertension, obesity diseases, that are directly related to the way we relate to food. We need to start as parents to relate ourselves with food and nutrition on a healthy manner. It really breaks my heart when I see a child struggling with obesity and the mother or the father is very concerned, but they are also having the same problem. And it breaks my heart because there is a need for the family altogether to start a new beginning in how to eat and how to make the change and the transition. And I think this is the problem that we face. Because as I said to my parents in the past, and I say it every day, we all know that we need to eat healthy. The challenge is how. The how to do this is really challenging. And I am a great advocate, a strong advocate, to create programs that are going to impact the how to. I'm not going to repeat, oh, we have to eat healthy. I want to show you and hold your hands as a parent how to do it. What kind of food to buy, how we feed our kids since they are young. Because without being accusatory, if a child doesn't drink water and only likes beverages that are high in sugar and very unhealthy, he learned about that behavior from what we showed him or her as a child. So we teach them. So the question is, how do we make this child unlearn what we had already teach them? And that's what I spend most of my time as a pediatrician.
Well, it's a beautiful and a very holistic and, good way of going about it, because you're looking at the cause and you're getting it before it becomes a problem, and habits and things that we get accustomed to. It's so true, which is what I found. And, when you were speaking, I met you at the Dominican Medical Dental Congress a few weeks ago. I was very impressed by your level of integrity, and I'm sure that all your patients at Ola Pediatrics are very happy with you. And you're going over some things that I think in our world have gone in the wrong direction, and it's nice and a breath of fresh air that someone like you is looking at it realistically, looking at what's really going on. And so I want to ask you, because you made some comments on this at the Congress, and I thought it was important to ask you again. What changes do you feel physicians and medical and health professions, as doctors, what do we need to do in general in terms of our patients, and also in terms of this marijuana problem that's affecting our youth?
Well, let's go to the do part. I ask myself, what can I do for this and this and this situation? Different things that I found in my patient population. But after what I've learned, especially after the COVID pandemic, I believe that the times of doing are over. We have really to be calm. We have to be. We have to be the doctors that are going to say no to the current paradigm of platforms that does not benefit the human condition. We have to become the doctors that are going to lead the new generation of humanity, of children that are going to say no to the lies of the past. We've been so naive, so innocent, that we have bought so many false, and we have bought into so many unhealthy nutrition, emotions, substances that we put into our bodies because we innocently believe on that. And because parents are distracted, having to work full time to bring food to the table, but then expected to raise kids as stay-home parents. It's time to say no to that.
Absolutely. There's a big problem in the world because the family structure, which is so important to how kids, like you said, the example that they see, it doesn't exist. The parents have to work because things are so expensive. There's so much stress. So then maybe they get home, but the parents both are very stressed out. And so they may not be in the frame of mind to deal properly with their kids, who haven't seen them all day. And the kids, obviously are with each other during the day, so they have similar experiences. And so what's happening is you don't have that time around the dinner table that used to exist years ago. It almost seems like it's disappeared. Now everyone is on a cell phone and people eating separately, and they don't speak with each other because instead of speaking with each other, they're speaking on cell phones, on social media, and we're losing touch of our humanity. You're so right. At the Congress, you mentioned some things about your feelings about what was going on with the marijuana situation. Tell us a little bit about that.
I've seen the damaging effects of marijuana, cannabis, and all its varieties first line with my patients. I believe that one of the great damages is that marijuana kills the drive that a person needs to progress in life. Academic failure is one of the main concerns. Procrastination, a slowdown in the acceleration that you need to attain your goals. I understand that marijuana really slows the reticular activating system in the brain, and that system is there to propel you, to impulse you to attain your biggest goals. So our kids have been involved in the lie that marijuana is not dangerous. I consider this drug greatly damaging and dangerous.
Yeah, you know what? Obviously, since I run a drug education program and as a doctor myself, I've seen its effects, and I've found the same thing as what you're saying. And I'm really amazed at times at how it is that our medical and health professions, all of us really, I don't like like you said, I don't like pointing fingers. I like to do proactive, positive changes. But I'm amazed that somehow that the health professions have been almost quiet while all this legalization has been going on. You know, getting at it from that perspective, what's your personal feeling on it? Why has it been that with all the studies that we know in the Journal of Medical Association, New England Journal of Medicine, in the psychiatric journals, in the Journal of Medical Ethics, all the results in the CDC, Dr. Nora Volkov, who's the director, all the results have shown that the marijuana is damaging to the brain, to the development of a youth, of a young person, and somehow, and the psychosis in young kids that are born to mothers who are smoking, and that it was being actually given in dispensaries in Colorado for pregnancy blues and symptoms. And so, what is your feeling on this important topic? How has this happened in our country?
I don't see that any different that to the case of the food that we serve to the children in our schools, because they're not serving the health of the kids or the family, of the human condition. They're serving a financial platform, and that is very sad, but it's very true. At least that's the way I perceive it. And I really hope, and I know that we have what it takes to show our children a better version of themselves that don't need any marijuana or any drug to be who they are. They are much stronger than that. They are more resilient, and they have a lot greater possibilities to accomplish into their lives. Whatever happens to a person is just a moment in time. You could call it poverty, emotional problems, health conditions, situations, family problems, depression, personal things. However, the spirit of the human being, the soul, is much greater than all of that. And it doesn't matter what happens to you. It matters what you do with it. You could use it to impulse you, to push you forward into your gains, or you could use it to stay sitting in the past and using substances to keep you hold and attached to the past. I invite every person to take control of the impulse that circumstances are there to impulse us to be better and happier.
Absolutely. You know, I totally agree with that philosophy. To me, I feel that as human beings, we have tremendous ability and energy when we're on our right path. And we've gone off in the wrong path and we've gotten apathetic. We let things happen. We've lost the care for our own world. So, you know, it's a pleasure to have you here. And when I met you at the Congress and we spoke about creating education to educate kids about and families and mothers and fathers about the dangers of marijuana. So, you know, to those of us who are watching tonight and watching you and I on the show, they're all welcome to participate, you know, and Dr. Olivero at Ola Pediatrics, she's going to be participating with Drug Free World. And if those of you out there want to educate and do something about what's going on, you know, I have a physician coming on afterwards in another show, Dr. Fernando Taveras, who is another physician who deals with the problems of marijuana, is going to be speaking about this and the horrific problems that he's seeing in their psychology, their mental side, and it's amazing. So for those of you who are interested, go to drugfreeworld.org and download it. It's in 22 languages. You know, Doctor, it's a pleasure having you. What would you like to leave as a concluding remark for the viewers out there watching you? Because we only have about a minute left in the show. Go ahead.
I want to leave the parents with this power. Your kids see you as their hero. They love you, they admire you, they learn from you. Among everything, make this time, take a date with your child and talk about this since they are young. And be truthful that we're all going to succeed to create a better world free of drugs. Thank you.
Well, Dr. Olivero, it's been a pleasure having you, and I look forward to working with you some more in that aspect and moving forward to make our communities really safe. I agree with you also on nutrition. I'm a very big proponent of nutrition in my own life and exercise and everything you said. So hopefully all of you watching this show, let's take heed of what Dr. Olivero has mentioned. She's a physician. She's trained with some of the best physicians in the world. She's giving you scientific advice, not philosophy, not marketing, and not sales and economics. You know, when you look at it, if you lose your health, what does all the money in the world mean? And if you lose your child because what you're hearing turns out to be the truth, are you going to really ever forgive yourself for not having done something? So, Dr. Olivero, muchas gracias. Thank you so much. And for those of you watching, by all means, let's make that better world. Let's look at the nutrition our kids are getting. Let's fight for our kids. And you know what? I think we'll find that energy that we've been missing, and it'll come back. Have a very good day. Thank you, Dr. Olivero. I definitely recommend what you say, and I can tell all your patients at Ola Pediatrics are probably smiling ear to ear. Have a great night, and we'll see you at the next segment of A Time for Truth show.
Thank you.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got. The world takes you down. You just keep moving on. Let your feet